Hello! In this short video, I would like to spend a few moments going over the details of the preparation for your upcoming colonoscopy. A clean colon is of the utmost importance in order to get the best exam possible. I would also like to thank you for choosing to schedule your procedure with Dr. Akerman. Please remember that all of our staff members are here to help make sure that this is the smoothest and easiest experience that it can be. First things first, you should make sure that you have your preparation medication in hand from the pharmacy, even if it is several weeks in advance. This may be a prescription laxative that was called in, or a purchase of an adequate supply of Miralax for your prep. If you were prescribed a prescription laxative and either your pharmacy does not have it available, or if the prescription is too expensive, please make sure to send the office a portal message as soon as possible so that we can help take care of this for you. In the week leading up to your colonoscopy, please make sure to check the instructions that you were given and verify if there are any medications that you are currently taking that you are supposed to stop in advance of the procedure. Some examples may include aspirin, blood-thinning medications, and some nutritional or dietary supplements. If you were instructed by our office staff to perform a 2-day prep, you will take your extra dose of Miralax at 6 p.m. 2 days prior to your colonoscopy. For example, if your colonoscopy is scheduled for Wednesday morning at 10 a.m., you would take your extra Miralax dose on Monday evening at 6 p.m. Please note, this only applies to those patients who require a 2-day prep for extra cleansing. On the day prior to your exam, you should only drink clear liquids. No solid food should be eaten, as we want you to stop making any new stool. Clear liquids include black coffee, juice, tea, popsicles, water, Gatorade, and soup broth. In our example of a patient having their colonoscopy on Wednesday at 10 a.m., the day prior to the exam we are referring to is Tuesday. At 6 p.m. on the day prior to your colonoscopy, you should take the first dose of your colonoscopy preparation and drink it completely within 1 hour. You may still continue to drink clear liquids until midnight, at which time you should no longer eat or drink anything except for any remaining scheduled colonoscopy preparation. Lastly, 6 hours prior to your scheduled colonoscopy, you should drink the second dose of your colonoscopy preparation and complete the dose within 1 hour. At this time, you should no longer be drinking anything further.
A question we often are asked is, what should my stools look like at the end of the prep? Once you have completed the prep, the ideal bowel movement is one that is liquid and typically will be a thin yellow or green color. A few other additional pieces of information. Any foods with small particles such as corn, seeds, or strawberries should be avoided for 3 days before your exam, as those particles may be difficult to flush from your colon even with laxatives. You should also be aware that the endoscopy center has strict guidelines regarding the use of alcohol, tobacco, and marijuana. In general, all of these substances should be avoided for 12 hours prior to your procedure. Otherwise, we may run the risk of the procedure being canceled due to an increased anesthesia-related risk, and we want to make sure that we keep every patient safe. Thank you for your attention to this video, and hopefully we have made the pre-procedure process a little bit easier for you. If you have any further questions regarding your procedure, do not hesitate to reach out to our office via the patient portal system, email, or phone.